So good morning, everybody. Good afternoon, depending on where you are. Welcome to today's NTAC session entitled Minds Matter, Strategies for Supporting Students with Mental Health Challenges in School. We are so happy that you all are taking time out of your busy schedules to join us today. Before we get started, we do have a few housekeeping items to go over with you. But we would love, and we're going to introduce ourselves more in a second. So I'm going to go over these housekeeping items and then we'll have some introductions. As part of our session, we have to provide you with this disclaimer. This presentation was prepared by NTAC under a cooperative agreement from SAMHSA. While this event is supported by SAMHSA, the contents are those of the authors and do not necessarily represent the official views of SAMHSA, HHS, or the US government. While we hope that there are not any security issues that happen today, in the event that any may occur, the session will immediately end and you will be notified by email how to rejoin the session. Thank you again for attending one of our NTAC sessions. Listed here are all of our incredible national partners that have come together to utilize their expertise and their subject matter knowledge to help inform the field by creating products, resources, and sessions like this one to enhance the behavioral and mental health fields. As a center, our vision is that all children, youth, and families living with and impacted by mental health challenges will have access to the resources and opportunities they need to thrive in a comprehensive and equitable system of care. We serve a wide cross-sector audience, including everyone from state leaders to providers, to the school workforce, infant and early childhood providers, community-based providers, peer supervisors, family partners, youth partners, and much more. Our services range from individual consultation to more in-depth sessions like the one we are offering today, to peer learning exchanges and tools to help you. Our aim is to really create those outlets for communication, collaboration, and resource sharing among all of us. Please make sure to check out all of our resources and archived presentations on our website, or go to the contact us link there to request consultation or training. Before we get started, we want to address some commonly asked questions that come up during our sessions to let you know before we get started some answers to these questions. In the follow-up email for today's session, you will receive a certificate of completion, a link to the recording of the session, and a copy of the slide deck presentation that is being shown. You should also receive a copy of the slide deck in the reminder email that was sent earlier today or yesterday if you would like to access it for today's session. Now that we've made it through our housekeeping items, we want to welcome you again today to our session, Minds Matter, Strategies for Supporting Students with Mental Health Challenges in School. Our presenters today are myself and Ms. Ariel Brooks-Porter. I am a child and adolescent psychiatrist at MedStar Georgetown University Hospital. I also work for the MedStar Center for Wellbeing and School Environments, where I see students in school as a psychiatrist and also consult with school staff and providers on managing these kids in the school setting. I'll also mention that before I went to medical school and became a doctor, I was a teacher at a public charter school in DC, where I taught middle school physics and remedial math. So I have some experience on both sides. And I will hand it over to Ms. Brooks-Porter to introduce herself.
Hello, everyone. Thank you so much for having us and coming to our session today. My name is Ariel Brooks-Porter. I am a special education professional. I currently work with the DC Prep Public Charter School. My passion for special education has derived in the fact that all students deserve access to high quality learning. We know that though people learn differently, we as educators and people who care for students have the opportunity to create access by implementing different ways for students to learn in school and outside of school. So I'm excited to chat with you guys today about today's topic, depression and anxiety.
So we have an agenda for today. I want to start out by getting to know everyone here. Then we will do a check-in on mood to see where everyone's at today. Make sure we're checking in with ourselves and getting ready to do some learning and collaborating. We're going to do a very brief presentation about depression in students and some things to look out for in schools. And the majority of the session is going to be dedicated to talking about cases that you all may have that would be helpful for us to consult on and for us to all discuss as a group. And so I'm hoping that will really be the bulk of the session. We'll have some really good, rich discussion as professionals on how to help a student in need. So to start out, we're going to do some introduction. I'm going to stop sharing the slides too, so we can all see each other. I would love to have people turn their cameras on and to introduce themselves, your name, your title, where you are, and what you hope to learn from this session. I know I and Ms. Brooks Porter have already introduced ourselves. I'm wondering, I'll kind of go down my list maybe and just ask people to introduce themselves. So I'm going to start with Joanne Bloom. Can you introduce yourself, please?
Hi, everybody. I'm Joanne Bloom. I am the INTAC tech host or tech support for the session. So if you have any issues during the session today, please feel free to message me and I'll do what I can to help you.
Okay, and then we have Karina Joyner.
Hi, everyone. My name is Karina Joyner, and I am a research associate with INTAC, and I'm here taking notes.
Okay, thanks, Karina. And those notes will also be for whatever recommendations we make or resources we talk about. Those will be sent out to you after the session. Okay, now I have Abra Vermette. Maybe she's not ready to introduce herself. How about Ayana Adams?
Hi, just joined in. What's the question?
Oh, we're doing some introductions. So if you
Oh,
could introduce yourself, your title, and where you're coming from and what you hope to learn from the session today.
okay. Ayana Adams, prevention therapist, calling in from Ocala, Florida.
Hi. And what are you hoping to take away from this session today?
Everything that I can. Didn't really come with anything in mind, just here to learn and glean from everybody else.
Awesome. Well, thank you for being here.
Thank you.
I have Blanca Valadez. Are you here, Blanca?
Sorry, it was on mute. My name is Blanca Valadez. I am from Caldwell, Idaho, and I'm a wraparound care coordinator.
Awesome. And what are you hoping to take away from today's session?
I didn't have anything in particular. I just came to learn and just expand my knowledge.
Awesome. Thank you. Glad to have you here. Okay. Charlotta Roselle.
Yeah, you pronounced it right. Thank you. Hey, everyone. I'm Charlotta Roselle. I'm an associate professional counselor in the state of Georgia. I'm actually a school-based clinician. I work for a nonprofit agency, Viewpoint Health with Apex. And I just wanted to hop into, I don't know, learn some tidbits. And I mean, I'm already doing the work, but it's always good to hear how else we can provide support and get some new ideas on providing support to the students.
Absolutely. Thank you for being here. Awesome. How about Diana Liu?
Hi, I'm calling from LA, California, and I work with maternal child adolescent health programs. And like other attendees, I'm here to learn just as much as I can about the topic and how we can support our youth and students. Yeah, thank you.
Great, so good to have you, Diana. Francisco Jimenez.
Yeah, my name is Francisco Jimenez. I'm with Cafe here in Wenatchee, Washington. I'm just trying to learn and see how to work better with teens. We're starting a new teen program here, so trying to see what kind of info and insight I can get from you guys.
Great, good to have you. Jennifer Leroux.
You were close. Good morning. I'm Dr. Jennifer Leroux. I'm with the Missouri Department of Mental Health. And what I hope to gain from today is any additional information about the latest best practices for children struggling with depression in schools.
Okay, good. Nice to meet you. Lori Deschen. Okay. How about Maria? I don't have a last name there.
Maria shared in the chat. She's having a cold and
Cold.
can't
Oh no.
camera, but she is Maria Del Rio. She's from Sacramento, California, and is an AMFT and APCC mental health clinician. She's interested in hearing more about ways to address anxiety and depression and adding to her skill set.
Okay, great. Oh, and Lori did also say too, she's having tech issues, but is a BCBA in Olympia, Washington, working with elementary and middle school students. Thank you, Lori.
Olivia, can I introduce myself now? Sorry.
Yes, absolutely, please.
So I'm Amber Vermette. I am actually in a grant that is encompassing mental health within a school district. So I do the case management part of it. And I have youth peer advocate and a peer advocate and a counselor that is part of our group embedded in a school. And so I have a degree in teaching, but I love mental health. So I'm anxious to see what else has changed in the school districts when I'm not a teacher. So any little tidbits or information I can use to benefit the student body of the school is what I'm hoping to learn. Oh, and I'm from upstate New York, so this is 3 hours north of Albany. So I'm on the literally 2 miles away from the Canadian border.
Okay. Did you have that snowstorm recently? That big snowstorm?
We did. We had I don't even know how many inches, but we've had back to back within a couple weeks of each other. Yeah. Yeah. I was in Burlington for the one that was 2 weeks ago. That one was kind of crazy. This one was a normal one for us, I guess. So just drive slow and take your time.
Okay. Well, glad you're here with us today. How about Maria Slaughter?
Hi.
Hi, good
My
afternoon.
name is Maria Slaughter. What was the thing? Okay, my title is a wraparound case manager, and I'm calling from Houston, Texas. And what I hope to learn is, just something to help because, I work with kids in the school setting as well, and just want to get all the tools I can get.
Awesome. Glad you're here. Patricia Correa.
Yes, good morning. How you doing? I'm Patricia Correa from Forward, Texas, and I work in wraparound services, and we also have community-based care. So I'm just here to go ahead and learn about best practice because we review compliance for our providers. So we just need to make sure that they're providing the services that our kiddos need in school.
Great. Thank you. Ruth Sun.
Oh, sorry. I'm Dr. Sun. I'm the psychiatric occupational therapist. I'm with the early psychosis program. I don't have any expectation. I just come and learn.
Okay, good to have you. How about Taylor Alsop?
Hi, I'm Taylor Alsop. I'm a prevention coordinator out of Ohio. I don't have my camera on because this is my time to eat lunch, so I figured no one wanted to watch that. And I'm just interested on building my knowledge with some things that I can do in school to help with our students.
Yeah, and you can absolutely eat lunch on camera. That's totally fine. But if you're not comfortable with that, that's fine too. How about Veta Belford?
Hi.
Hi, good
Good
afternoon.
morning. So, I am a peer specialist for Sacramento County. So I just want to get more knowledge because we do work, where I do work with the community wellness response team. So I just want to get more knowledge to help out if we ever go to schools or colleges, because we do go on to those type of calls to do what I can do as a peer to help them out.
Definitely. Good. Nice to meet you. I think there are a couple of people who joined while we were doing introductions. Afifa Tirmisi. Okay, and then we've got Alexis.
We have Alexis. She said her microphone's not working right now on her laptop, but she is Ali Kuzmer Psych. Hopefully I didn't butcher your last name. I apologize. She is a school social worker from the Chambersburg area in Pennsylvania, and she's just here to increase her knowledge in her area of practice.
Awesome. Well, it's really great to have everyone here. Was there anyone who I missed who hasn't introduced themselves? Okay, good. All right, I do really want to make sure that this is a space for everyone here to be able to share students that they're working with that they may be having trouble with, or like be able to collaborate on cases that are difficult. So we're going to present just a little bit about depression in schools. As we're presenting, I would like for people to think about a student that you may be struggling with, or think that would be helpful to get some tips from other people in the field on. And we're going to ask for that after our short presentation. It doesn't have to be a student with depression. It can be anybody. And my hope is that by presenting a case that somebody is working with, we can really be helpful practically for these students that you all are seeing. So just keep that in mind as we start this presentation. Okay, so I'm going to share my screen again. Before we get started, I want to check in with everyone here. I know some people said they weren't feeling so well. You might be coming from other things. This might be the first thing you're doing in the morning. I'd like you to think about an emoji or 2 or 3 that represents your mood, how you're feeling, and type it in the chat, and we can get kind of a sense of where everyone's at right now.
We have a few in the chat. Thank you, Ayana. Thank you, Alexis, Diana, Taylor. Thank you. Okay, hopefully you feel better, Alexis.
Oh, good. I've got some. Oh. We've got some smiles. That's good. Calm smiles. Celebration. It is Friday.
It is Friday. I know, I'm so excited about that. Thank you, Vita and Charlotta. Okay, so everybody's kind of like, okay, smiley, real chill, calm, collected.
Friday, we're here for
That part. Okay.
Good, good. Okay, well, it seems like a lot of people here are ready to learn, which is awesome. Okay. So what we're going to talk about today is depression. I think it's more common than we would like it to be. And it's something that's really important to know as an educator or someone who's working in schools, because a lot of times you all are the ones who pick up on it because you're seeing these kids every day. A couple to start with, just a few stats. There's about 2.7 million children between 3 and 17 that have depression. And ever having been diagnosed with either anxiety or depression among children 6 to 17 years old has been increasing over time. That question had a positive response on surveys as 5.4% of kids in 2003, 8% in 2007, 8.4% in 2011 and 2012. And those numbers have been increasing and have especially been exacerbated by the pandemic. The other thing that's really important to remember with depression is that substance use and suicide are really important concerns in adolescents between the ages of 12 and 17. The reporting in the past year, 2018, 2019, was that 15% had had a major depressive episode. 36% had had those persistent feelings of sadness or hopelessness. About 4% had a substance use disorders. 18.8% seriously considered attempting suicide. That's about 1 in 5 kids, which is really concerning. 15% had made a suicide plan. Around 9% had attempted suicide. And 2.5% had made a suicide attempt requiring medical treatment. So really important to pick up on this early to try and prevent these kinds of things from happening. So I'm a psychiatrist. So from the medical provider point of view, I thought it would be helpful to share a little bit about how we diagnose depression and what it really means. Depression doesn't equal sadness. There's this diagnostic criteria that we look at to really categorize a major depressive disorder. And the criteria are a little bit different for children compared to adults. So I think it's good to kind of go over and have an idea of what we're looking at when we say depression. So the criteria that we use is that over at least 2 weeks, and it can be longer, you have to have at least one of these 3 symptoms: anhedonia, which would be defined as a loss of interest or pleasure in almost all activities. Kids might say that they just feel really bored all of the time. A persistent sad mood, and this is the thing in kids that's different from adults. In kids, if you see a persistent irritable mood, that can count as the mood change that qualifies someone as meeting criteria for depression. And then in addition to one of those 3 things, you would need at least 4 of these other symptoms, which is a change in appetite, a change in sleep, psychomotor changes. So that would be like really restless and agitated, or like really slow to the point that other people are noticing. Trouble with thinking, concentrating, making decisions, recurrent thoughts of death or suicidal ideation, feelings of worthlessness or excessive and inappropriate sense of guilt, and then this fatigue or loss of energy. And I think something important there with the fatigue is that it's not sleepiness necessarily, it's just like feeling really dragged down. What might you see with these symptoms? Like, how might that look in the classroom? And I'm going to turn this over to Ariel to talk a little bit about this.
Thank you so much, Dr. Hamra. Before I go ahead and jump into what this might look like, I want to give us an opportunity to share some information in the chat. I'm dropping a question right now, and I want you guys to think about what are some ways this may look in a classroom? So when we think about depression and what it looks like, what are some things you could possibly see inside the classroom environment? I'm gonna give us about a minute to start jotting in the chat, and then I'll go through with some things that are often seen in schools when children are showcasing symptoms of depression. Thank you, Maria. Yes, irritability, withdrawn, lack of hygiene, yes. Yep, Taylor. Yes.
Yeah, trips to the nurse, trips to the bathroom, restlessness, definitely.
Yes. And so, right. Yes, a lot of these things that you guys are noticing or are noting are things that we see in schools that can raise a red flag, especially if it's happening a lot. Sometimes it's those trips to the nurse, the somatic complaints, the headaches or the stomach aches, right? Or the change in your work completion. Now, kids who used to be interested and want to do the work all the time are bored or don't want to do it anymore. They don't do anything. They may seem tired or just completely withdrawn from the classroom environment, unable to receive any feedback from their teachers. Not having an appetite, not wanting to eat lunch, snack, things that they usually enjoy to eat. More opportunities where they're feeling sadness, they're crying, their heads down. They can't maintain some friendships and relationships. They're sleeping in class. All of those things are what impact students and create triggers for us as educators to kind of think about, what is changing at home for this kid and how can we support them moving forward? We're going to move on next to how we might respond as educators. What are some things that we may do to help kids? Some of the things are we're providing them some space and grace. We understand that while they're students, they are also human. And we all encounter times in life where things are not the best, right? So we want to provide them some space and some grace, an opportunity to understand and relate and continue to be a shoulder for them, a supportive adult for them in their life. When we notice these changes, we also want to notify the family. Asking them to see if anything has changed also helps us to create the best supports for students at school. Next, we want to notify our school counseling team. So just conduct a quick check-in. See if there is anything that they could do to support the student or resources they can implement to support the family. That could possibly be referral for treatment or referral for their families for treatment. It could also be classroom interventions that they're implementing so that students can have access to the curriculum, even in moments like this. I'm going to ask you guys another question, and I'm going to ask you to answer it in the chat. I want you to think about this. When we think about depression, and how that manifests for the students we serve, there are things that we can do as educators, as dedicated aides, as doctors, as counselors to support our students. What are some of the things that you have tried thus far? I'm going to give us a minute and then we're going to answer that in the chat. What are some of the things that you've tried thus far to support students who are exhibiting some of these behaviors, or as we see depression manifest in our classrooms or in our schools? Giving them words to match their emotions so they can explain what's going on. Yes, Abra. Mm-hmm. All of these are super important things that students deserve. Yes, Diana. Oftentimes when I think about students, I think about how I'm an adult and sometimes I don't have all the answers. So I can only imagine, that's the timer. I can only imagine how a student is experiencing their different life turns and twists. A lot of these things that you guys shared are super important. And as people in schools, educators, supporters of students, sometimes it's not always super easy to do these things. Before I move on to the next part and we get into discussing some of those screening skills, I do want to open the floor for someone to share. I'm reading Maria, yours. I really love that one. She just said, provide students with validation. Can someone come off mute and share why it's important to provide students with validation, especially when they're feeling down, and showcasing bouts of sadness, boredness, or possibly symptoms of depression?
I will talk. So validating them that what they're feeling is real, so they don't feel isolated in that, and make that even worse. You know what I mean? Feeling that isolation already and then feeling like you are alone just makes it even worse. So validating that they're not alone and it's okay to feel those ways.
And
Yeah.
Yeah, you can go, Diana.
yeah, I was just gonna say I echo that, and I also kind of think back when I was a teenager. I think that I feel all these things. I feel like I'm the only one in the world that feel that way, and then turns out that a lot of my peers at my age feel the same thing, but I didn't realize that because I didn't feel like other people are going through the same thing. I feel like I was the only one in this world that's feeling that way because
Yeah, absolutely. And I'll also bring up that like a lot of times kids will hear things like, oh, that's not true, or oh, you're fine, or you'll get over it kind of thing. And that's not like the way to validate is say, wow, you're going through a really hard time right now. Reflecting on what they're telling you. That's the important way to really be present and be with them.
Perfect. Thank you. I had to jump up really quick. We have some kids who wanted to knock and see if I was okay. But yeah, so a number of these things are super important to ensure students feel seen, right? We know that they are human just like us. And sometimes it takes taking the space, providing that grace to show them that we are there for them and that we'll continue to support them with whatever it is they're experiencing outside of school so that they can have access inside school as well. I'm going to pass it back to you, Dr. Hammer, as we jump into the depression screening scales for youth.
Yeah. I'll also mention that with notifying the family and thinking about referral to treatment and creating this like inclusive classroom and trauma-informed environment, there's also really specific interventions that can be implemented for students. Like we talked about having trouble concentrating or like thinking straight and making decisions when you're depressed. So things like giving extra time on assignments or tests, maybe having time for one-on-one instruction with teachers, making sure there's like good access to a safe person or a school counselor, being able to take breaks if you need to take breaks, and encouraging like peer interaction. So like working in groups or having a partner or a buddy, like all of those things can be really helpful for a student that's experiencing depression. That can be implemented. It could be done more formally, like in a 504 plan. There's students who are struggling more and might need an IEP. And so all of those things are options for a student with depression.
And I think it's super important to think about when we're thinking about like accommodation. Sometimes it's like, oh, we can only provide this if a student has an IEP or a 504 plan. And I think it's important to note that some of the accommodations can be used as accessibility accommodations. And so if we know a student does need some more support, right? And they could benefit from having a little more breaks during their day, we can think about how we're implementing that as a tier 1 strategy to meet kids where they are. And like sitting them with kids who they enjoy being around, that'll help them get the work done, that'll keep their spirits up. A lot of these things don't have to just happen because they have an individualized education plan, but more so because we have relationships with our kids and we understand what will best set them up for success.
Just a few screening scales that I added in here. There's links to them. These are all free open access screening scales. For kids who are older than 12, the PHQ-9 and the Columbia Depression Scale are options. The Columbia has a parent and a child report form. So those can be good options for like the adolescents. And then if you've got younger kids, there's the SES-DC and the CADS, which are also just self-report screening forms. Sometimes for a younger kid, they may not be reading. You would have to do it with them. But these are good self-report and validated depression screening scales that if you're suspecting depression in a student, they would probably be useful to use. I wanted to really quickly go over medications that are used to treat depression, just because this is a question I get a lot as a psychiatrist. And I think as an educator, it can be important to know if you know a student is starting medication. So the most common first-line treatment for medication for depression in kids are SSRIs. That stands for selective serotonin reuptake inhibitor. The three most common and the ones that are FDA approved for use in kids with depression are fluoxetine, escitalopram, and sertraline. The brand names for those are Prozac, Lexapro, and Zoloft. So you'll probably hear those names. Their first-line treatment, about 60% of kids will respond to an SSRI for depression. In kids, fluoxetine or Prozac is actually the one that works a little bit better than the other ones based on the studies that have been done, but they're all really good medications. They're the most effective when they're paired with regular therapy. So we know that medication alone does not work as well as medication paired with some sort of regular individual therapy. They take 6 to 8 weeks to take full effect. So starting a medication doesn't mean a kid is going to feel better right away. It's going to take some time. And so that's really important to know. The other thing, it's really important to be consistent. So the parents and the students have to know that they have to take it every day, and missing a dose makes the medication less effective. When people start taking these medications, they may notice like nausea or diarrhea. That's really common, and it usually goes away after a few days. Sleep disturbance, specifically waking up more overnight, can happen. That also usually goes away, and same with headache. The other really important thing to know, and parents bring this up a lot as a concern, is there's an FDA black box warning on these medications for increased suicidal ideation and behaviors. It's something that it was issued in 2004 after the FDA did a meta-analysis on outcomes with use of SSRIs in kids. It's only a warning for people who are younger than 24. And what they found was that in these kids, about 4% of the kids who were prescribed SSRIs had suicidal thoughts and behaviors. And 2% of the kids on placebo had suicidal thoughts and behaviors. So it was like double the risk, but still a small percentage overall. There have been studies since then that have not been able to replicate that risk. So I think that's something that's really important to tell parents. There was no increased risk of actual completed suicide or fatality from taking these medications. And when this black box warning was issued, there was a period of time where there was a dramatic decrease in the prescribing of these medications. And along with that decrease came an increase in suicides. And so we really have to weigh the risks and the benefits of taking these medications. Ultimately, having untreated depression is a higher risk of suicide than having depression that is treated with an SSRI. And so I think something that's good to know. At the same time, because the black box warning exists and because this data exists, we monitor these kids really closely and we ask them a lot of questions about how they're feeling. The other thing to know is some kids have family history of bipolar disorder or mania. With the SSRIs, there is an increased risk of causing mania. In a child who has bipolar disorder, the risk again is relatively low. but it's something to know if that's a concern of the family. So just like, that's like a quick overview of SSRIs, and it's good to know. These are some resources you'll have access to when you get the slides, just things about depression in schools. So I guess I'll start by saying, does anyone, stop share, have questions about any of the things that we presented or things that would be helpful to talk about or clarify? Does anyone have a case, like a student who they're working with or who they know that they're struggling with or would like to talk about today?
So we have a child, she is 11, I think. And
One
was
thing I'll
just,
say, just don't use any names or like identifying
no,
information.
no, I wasn't, yeah, no, I wasn't going to.
I forgot to say that.
So she's 11 and she just was removed from her home and put into foster care. And so what we're seeing is a lot of trips to the nurse, stomach aches, headaches, wanting to not be in school where there wasn't an issue before, and her not knowing that that is related to being put into foster, you know what I mean? Like it's, and that's where that came up of learning words and giving her words. And so then when she's talking to her teacher, she can be like, oh, this is, I'm worried about my mom, or I'm worried about this, or just giving her that empowerment, acknowledging it, but still working through it. Like you can't avoid that kind of stuff. I'm just trying to look for other stuff that we can do to support that.
That's a really good case. Thank you, Abra. So this is an 11-year-old who's removed from her home, and you're seeing a lot of somatic complaints, not wanting to go to school. What other questions do people have about this case that would be helpful to know?
One of the things that I would ask are what are some of the things that you guys have started trying to support the student so far?
So the youth peer advocate, the peer advocate and myself all share an office. So we have open communication with the teacher and said, if she shows symptoms of this, please bring her to our office instead of the nurse, so that she can understand that it's mental health related rather than medical. And then she kind of decompresses and calms down by playing games with the youth peer advocate. But while that's happening, we're also trying to talk her through the emotions. And so then next time, instead of it internalizing it, she can talk about it, if that makes sense.
How has this student been doing academically?
Academically doing fine, just more decrease by like going to the, you know what I mean? Like that's a new thing for her, but it hasn't affected her academically yet. But the teacher did notice that she is, how did the teacher, like zoning, you know what I mean? Like she's like, I can tell it's on her mind. Like I can tell. And anything that they talk about in class, she kind of brings up something to that effect of mom, or, you know, that kind of stuff. So it's definitely, the teacher definitely knows it's affecting her.
How are her relationships in the classroom?
So that's a struggle that has been before. So up and down, up and down. Teacher says she reports even before this that she is mean and aggressive with her peers. So that's not a definite change, as I haven't noticed an increase in that.
Does she get any in-school counseling?
Yes, and I don't know the frequency of that. I think it's once or twice every 6 days. That's like we're like the letter system cycle.
This makes me think about what cross collaboration could look like inside the school environment to support your student. I'm thinking about like the connections possibly between her new placement. What are some like, has there been conversation around there outside of what's going on in school to kind of see like how she's being supported there? Are there some resources that could be implemented outside of school? And then also like, what does that look like within your office with the peer advocate and mediator and the teacher, so that there's at-bats at trying different skills inside the classroom that could also include the therapist or the counselor? I also think about if there are any specific students. I know she doesn't have many relationships, but if there are some students or a student who she could do like small things with, possibly like a lunch, or maybe they're doing breakfast together, where she could take some time to kind of think about her feelings, some zones of regulation work.
So there has been communication with myself, the peer and the peer advocate. With we're fortunate that an aunt was able to take her in as foster care. So the aunt is aware of the behaviors, and I told the aunt, just let us know how we can help. So there's the communication, and as the court care coordinator, I'm kind of trying to do that between the aunt and the teacher with the school. So the aunt has expressed that the honeymoon phase is over, so she's seeing more behaviors. And I let her know, just let us know what's going on. So she is more than comfortable doing that and facilitating that. And so when we become aware of information, we're sharing that with the school district and the counselor.
Are there outpatient supports in place, like outside of school? Like, for example, a therapist or a psychiatrist or anyone, or even a case manager?
She has a foster care preventative worker, but I don't know, like most preventative workers, they're really overworked. So communication with them is hard. So that is also part of what I'm trying to hope is have conversation with her and the foster. I'm hoping that, but we're difficulties getting a hold of her.
Yeah.
But I don't know of any services outside of school right now.
As other people here are hearing this case, are there things that you all have tried before with similar cases, or things that you've found to be helpful? Questions that you have? I'd really like people to jump in because you all are experts in your own fields. Okay.
I'm a big advocate for coping skills. I mostly work with the teens, but for a student this age, I don't know. I might provide maybe like a quiet area where she needs a timeout, and then where you're seeing those behaviors that are maybe disruptive to other children. If she just wants to take a time out, and just have time alone and maybe color or journal or I mean, I guess you just have to be mindful of like she's already taken trips to like the nurse's office and stuff like that. But if she just wants to take a quick walk or grab a cup of water or something like that, just to cool down, so then she can rejoin her group or the classroom. I think some helpful things like that. I think somebody mentioned like vocabulary, teaching what is it that you're feeling? How are you feeling it? I also teach something called like the SUD scale, subjective units of distress. And so we do it where, depending on how intensely you identify the emotion, what are some coping skills or what are things that you can do to offset those feelings or to bring you back down to your baseline to where you feel calm again, where you can re-engage with the other students and teachers. So that might be something to think about.
What was that scale again?
Subjective units of distress.
Yeah, it's called SUDS.
Yeah.
And there's different ways that people will present that. Like there's ones that are tailored for really young kids, and there's like, I know there's like a thermometer, like there's
Yeah.
ways that people will present it. And so you can kind of find what you think would work best for you or for your student. That also makes me think of even like preemptively checking in with the student, like let's say at the beginning of the day, like showing them that and being like, where are you, right? You know, how are you doing right now, right? Like we did a mood check-in at the beginning of the session too. Like, are you in a place where you're ready to learn? And even doing that throughout the day could be really useful. And I love that idea, Charlotta, about giving the student the ability to take breaks or to kind of like change up just sitting in the classroom if she's having a hard time focusing. It could be even within the classroom, or it could be a break outside of the classroom to kind of give her a way to take a break that's not just like, I have a stomachache, I need to go see the nurse. It could be more like, I don't feel like I can sit here right now, I need to take a 5-minute walk.
And that could be like the mood check-in in the morning, another one in the middle of the day, non-contingent breaks that she knows she's going to have every day, no matter what, at the same times. So it can kind of provide that regularity in her schedule, but also an opportunity not to opt out of the other things.
I like that, and I think that's something our youth peer advocate, I don't know if any programs do not have one. I absolutely love it. It's amazing to see a young person be able to relate to another young person and help them through the stuff. So I think that's something that partnership with this child will be beneficial.
Anyone else here with ideas, that things that you've tried or things that have been really helpful with a student like this? Well, we're getting to the end of our time, so I'm going to move to some of the closeout stuff. And I'll share my screen again to do that. And thank you, Abra, so much for sharing the case. I really appreciate you being brave and sharing a really, like, that was perfect, like something that's so relevant that we're all seeing and dealing with in school. So thank you. And I really appreciate that. We do have other sessions. So every Friday this month, we're going to be talking about a different topic. Next week, we'll be talking about ADHD, and then autism, and then post-traumatic stress disorder and trauma. We have set up a survey, so the link is in the slides. We'll also give it to you in the chat. If you would take just a couple minutes to fill it out, then each session we do can be better based on your feedback. So we would really, really appreciate you letting us know what was helpful and what could be better. Any other questions or comments or discussion right now before we close out today? Okay. If you missed the beginning of the session, we want to remind you again to be on the lookout for the follow-up email that you will receive after today's session. In this email, you will receive your certificate of completion, a link to the recording of the session, and a copy of the slide deck presentation that we've shown. We're also going to send out some notes on the recommendations that were made with this case that was presented and some resources that could be useful for that. We need to hear from you to keep bringing you these free resources. So there's another survey that's an important part of quality control with NTAC and to the future funding of this project. It allows us to continue to provide you with resources and training at no cost. In addition, it allows us to continually improve our services and provide information and resources you're needing in the field. If you could take a few minutes to let us know your thoughts, it would be greatly appreciated. You have 3 ways to access the survey. The link will be put into the chat box. It will automatically pop up in your browser when the webinar ends, and it will also be provided in the follow-up email sent after the session. So please take a few minutes to complete the survey, and your time and feedback are appreciated and valued. If you missed the beginning of the webinar, we want to remind you again to be on the lookout for the follow-up email. Didn't I already say this? And the slide deck of the presentation. And then here is our contact information, an email, a phone number, our website, and our flyer, and the link to request technical assistance. So thank you, everybody, for being here today. We appreciate everyone's participation. I would love to see some of the same people here for other sessions to kind of create a cohort or a community where we can all learn from each other. And I hope this was useful to you all. Have a wonderful Friday.
Thank you guys for joining us today. I hope this was helpful and it gave you something to take back with you. We hope to see you next week.